it's absolutely vital that this World Alzheimer's Day, we focus on raising awareness to Alzheimer's disease, but also the other conditions that are known as dementia.
Hello, everybody, and welcome to Chamber's World Alzheimer's Awareness Day panel for Innovating Healthcare. I'm Professor Lynne Corner. I'm the Deputy Director of the UK's National Innovation Centre for Ageing in Newcastle, and also the Director of VOICE, an international community of older people. And I have the pleasure of chairing this session. Today, we aim to highlight the impact of Alzheimer's disease and dementia and share recent advances in research, innovation and caregiving, and really discuss the strategies that are needed to improve dementia awareness, care and support in the UK. The panel will be discussing these issues and sharing their significant experience, insights and experience, and what is really needed to drive and inspire positive change in the fight against dementia in the UK. This is for World Alzheimer's Awareness Day on the 21st of September, and we hope you can join in the discussion on Twitter at @ChamberVoice and use the hashtag World Alzheimer's Day. We would really like to hear your thoughts about ways in which policymakers can help raise awareness and really respond to the challenge of Alzheimer's. Some of the key issues we're going to cover today include access to quality health and social care, support for caregivers, and adequate funding for dementia research and innovation. And we will also touch on the ongoing stigma of Alzheimer's and the importance of social inclusion through improved community support. We have a fantastic panel today. Welcome to you all, and I'm going to hand over now to each panel member to give a short introduction to themselves. Debbie, could I ask you to begin, please?
I'm Debbie Abrahams. I'm the Member of Parliament for Oldham East and Saddleworth, and I'm also one of the co-chairs of the All-Party Parliamentary Group on Dementia. I got involved with the Alzheimer's Society, who provide the secretariat to that group, after my mum, Angela, died of Alzheimer's disease, and it's something that's really personal and important to me.
Mark, could I ask you to introduce yourself?
Thanks, Lynne, and hello everyone. My name is Mark MacDonald. I'm the Associate Director for Advocacy and System Change at Alzheimer's Society. I've got a big professional interest in dementia and making lives of people affected by dementia better, but a big and more important personal interest as well, a bit like Debbie. Delighted to be here.
It's great to have you. And Carolina.
Hi, nice to be here. My name is Carolina Rubel. I'm a Senior Director in IQVIA, and I'm the head of the Neurology and Neurodisease team. All the working in Alzheimer trials for the last 20 years, and personally, neurodegeneration is at my heart, and I'm personally involved in this research of Alzheimer.
Fantastic. Well, a really warm welcome to you all. So we know that over 1 million people in the UK have dementia, and that's projected to rise significantly over the coming years. Some statistics show that 1 person every 3 minutes develops dementia. But what do you think are the most pressing challenges faced by individuals living with dementia? Debbie, is this something the APPG has been addressing?
We've been looking at a number of things. Most recently, excuse me, has been around the diagnosis rate and the variability across the country. But we also last year published a report on the social care workforce. And at each inquiry, we try and engage with people who are affected by dementia and their carers, particularly family carers, to get an understanding from them. And I'd say, again, from my own personal experience, but also from the several different inquiries that we've had, that obviously it's a bit of a shock for many people when people are diagnosed, but the importance of early diagnosis and the recognition that is the pathway to appropriate treatment at an early stage to delay the onset of other conditions is absolutely there. But also the signposting to the support for families. And there's a wider community aspect of this as well, and something we're doing here in Oldham about building up our dementia-friendly Oldham campaign, where more and more people are aware of dementia, of course, which Alzheimer's disease is the most common form, and to try and enable people to live well by ensuring that communities can support and enable both the people living with dementia, but also their families as well. And that means a whole raft of initiatives being brought in.
You've made a good point there, because obviously dementia affects family caregivers significantly, and unpaid carers. With someone with dementia, they save the UK economy around about 15 billion a year. They make a massive difference. But how can policymakers really enhance support systems to support carers and really look after them and ensure their well-being?
Well, at a local level, I'd say that is very much up to us to be asking the questions of our health and social care teams, and also making sure that, for example, we have the pathways not just on paper but also in practice. And I think that's very important. So having that dialogue with local agencies is very, very important, as well as with the voluntary sectors I've just mentioned. It is a community-wide thing that we need to do. But policymakers more generally, the way our political system works, as you know, Lynne, once there is a government, it is about influencing that government. And I work very closely and provide the nudges, I would hope, to government and to the health secretary, but also to other departments who have a direct input in terms of the support they provide families with living with dementia. It is very much up to the government. So, for example, we have pushed very hard for a dementia strategy. That didn't happen, but we do have the major conditions strategy. So again, it's important that dementia within that is taken very, very seriously and given the attention and focus that it deserves. And within that, ensuring promises around doubling research in dementia are fulfilled. I think, again, we've seen in recent years how fantastic our life sciences sector is, and it's a good way of ensuring not only can we support the development of new treatments and care pathways, but also make sure that we're supporting the economy in something that we're really good at.
And Mark, could you tell us a little bit about sort of the Alzheimer Society approach and what their role is in policy making in this area?
I mean, very similar to other interested parties like Debbie, like politicians like Debbie, like other like health and social care professionals, like people affected by dementia, like campaigners. We're all kind of in this world to ensure that people living with and affected by dementia basically get a better deal, because as far as we're concerned, the scale and urgency of the challenge of dementia has not yet been met with a really kind of adequate at-scale response. And this isn't a criticism necessarily of the current government or current crop of politicians. This is for a long time. It hasn't matched. We're talking about the UK's biggest killer here, and we're talking about something that at the minute, there aren't treatments, there is no cure. It's a degenerative disease, and it's something that causes enormous stress to the system. But more importantly than that, as Debbie was saying, it causes enormous stress, uncertainty, confusion to the people who have dementia and the range of unique experiences they and their families have. And so our role is really similar. It's bringing the voice of lived experience to the table. We are a big service providing charity. We are a major funder of dementia research. And I think we'd like to describe ourselves as kind of thought leaders in this space as well. And we want to bring all of that to the door of decision makers so that they can better prioritise what must be one of, if not the biggest health and care challenges of our time.
Absolutely. And I think, Carolina, if you could add in terms of this issue about access to quality health and social care is just absolutely crucial for individuals living with dementia. Diagnosis we've discussed, but can you tell us a little bit more about that, and also pick up on the fact that many people with dementia and their carers are older and so are naturally living with a number of different medical conditions?
Yeah, absolutely. And I think the thing is that from a global perspective, dementia has no boundaries, and it does not discriminate. It affects people from every gender, culture, religion, citizenship, sexual orientation, ethnicity. It does not have a preference when it comes to geographical location, be it remote or an uncrowded or an urban and very densely populated. It affects people from all levels of education and all financial status. But the problem is that when it comes to accessing healthcare resources for dementia, there are many boundaries outside. And there's a lack of awareness about signs and symptoms of this disease that definitely need education and awareness campaigns everywhere. The thing is that we also, in some poor places or maybe rural regions, you may have fragile infrastructures. You don't have healthcare professionals that may be able to recognize those early symptoms. You don't have the number of AD specialists to treat them. So definitely that prevents an early diagnosis and an early intervention of those patients and the appropriate support of those families. We also need some diagnostic tools. We need early and cheap biomarkers. We need access to disease-modifying drugs and to free public health care. The problem we see is that sometimes in certain regions, by the time the disease has evolved to its full manifestation, the majority of that people will require full-time care. And that's a problem because, as Debbie and Mark were saying, this has a big impact on family members and also on the healthcare system.
So access to timely diagnosis and specialist care, really important, and not to kind of
absolutely
existing inequalities worse effectively remains a key challenge. I completely agree. But it is an exciting time for dementia research in that I think there's currently over 140 drugs in trials for Alzheimer's disease, most of them aiming to slow down the progression of the disease, but they can take time. But this research funding is just absolutely essential to advancing our understanding of the causes of dementia and leading to some treatments. What do you think we need to prioritise in all of this, and how do we allocate adequate resources for dementia research? Debbie, Mark?
So I think, yeah. Go ahead,
Debbie.
Well, I was going to say, I introduced it a little bit earlier, but I do think in terms of fulfilling our commitment to doubling dementia research is an absolute must. And for all the points that you have raised, and there's so many different aspects of dementia research, right, as Caroline has just said, from the prevention side in terms of identifying biomarkers, but also in terms of looking at the different forms of care that can ensure that people live well with dementia, and that can happen, and for a long time, so that residential or even nursing care is a final resort really. At the moment, if we look at who is in our residential care facilities, majority of people are people living with dementia. What can we do to actually delay that and ensure that people can live well? And I think, again, there's lots of exciting work that's going on, both in terms of the biochemistry field. I was a former biochemist, so I would say this, but also in terms of different care solutions as well. And that needs everybody to get together. It also, our planning system, our housing system, all of these need to consider how are we going to ensure that we have an understanding, incorporate that into the design of our streets and our home environments, as well as our housing, our transport system. We're currently debating whether we should close ticket offices. That would be absolutely detrimental to so many people living with dementia. at the early stages who are still mobile and able to travel, that would really inhibit their being able to remain an active member of society.
Absolutely. And it's all about creating that choice, isn't it? But you made a really important point there about kind of nursing and residential care, and long-term care options are absolutely critical for people living, especially with advanced dementia. And as a carer, my family have experienced this. So, how can policymakers ensure that these long-term care facilities are quality, they are equipped to meet specific needs of people? Mark, have you got thoughts on this?
Yeah, I mean, it boils down, Lynne, doesn't it, to the state of the social care system, and the fact that remains kind of fundamentally unreformed. We know that people living with dementia are amongst the biggest users of adult social care, particularly residential social care. So it's, we've got a real stake in trying to get to a place where social care makes some improvements, that the system works, because it doesn't at the minute. We mentioned a wee bit earlier the plight of unpaid carers. These are the people that save the state effectively multiple billions of pounds a year. Yet we know people aren't getting kind of the recognition and support and the assessments that they need if they're unpaid carers. We know that with residential care in particular, but not just residential care, we've got real problems with cost and access and quality. The government has committed several times now to imposing a cap on the cost of care, but has not yet done so. For people living longer term with dementia in residential care homes, the costs become catastrophic quite quickly. And there's a real impact on people's lives and their finances. It's really life-changing. And that's before we talk about the workforce in social care. We really welcomed the NHS workforce plan that came out a few months ago. There isn't an equivalent social care workforce plan. We really understand the difference in the systems and the complexities of the involvement of different sectors. But there must be more of an effort to get, a group of unbelievably committed and professional people and support them to do the jobs that we know people affected by dementia really appreciate of them, which is, often really really intense, really personal care. We need to pay people properly. We need to create a more sustainable situation for the workforce. But the social care problem, we hear it time and time again, it is up there alongside diagnosis with the real kind of day-to-day top-end problems that people affected by dementia and their families face.
And of course, investing in that care workforce makes sense in terms of supporting the productivity of a wider workforce, because we need people to continue to keep working, to continue to be healthy. So it makes a lot of sense from that.
We always talk, Lynne, sorry to interrupt, about the false economy of not turning attention to social care, because if there isn't adequate social care provision, we know that people end up through unplanned admissions back into the most expensive bit of the pathway, which is the acute bit of the NHS. So it's not doing anyone any favours, let alone the people at the sharpest end of this, people living with dementia, if social care is not seen as part of the whole system solution to dementia.
It certainly seems to be something that we need to do, because we talk a lot about it. We seem to know about what a lot of issues are, but it seems to be about how we implement this now, which is so crucial. But I'm obviously the National Innovation Centre for Ageing. We hear a lot about some of the amazing advances in the Internet of Caring things, the technologies that are coming through to support people. And as Debbie said so well, in terms of in-home support to help carers to communicate and to care. What are your thoughts on this? Carolina, are you involved in anything like that?
Oh, so yes, we are. And I think that's where we have to go. Again, we have to support the families in all the ways. And one way is the technology. Nowadays, they need smartphones. Everyone needs smartphones to communicate. There are so many things can be done through smartphones that can help our patients and our caregivers. And we need support from the different pharmaceutical companies and from the governance to investigate and research on that. Because again, you can't take that to the patients if it has not been validated and a proper research has been done behind. And that's where I think we have to invest. And that's one of the ways to support our family and patients.
It seems that actually investing in kind of cause, cure and care remains absolutely critical, but investing in that innovation is just so exciting. And that's something that the UK can be at the forefront of course. Mm-hmm. Tell us a bit, I mean, I think Debbie, Mark, you've both touched on it, Carolina too, about international aspects of dementia, making the point that this is something that affects people from all over the globe. So this issue of international collaboration and how we can facilitate and encourage cross-border cooperation is really important in order to share those best practices. Tell us a little bit about the work that you're involved in that. Debbie, perhaps, to start.
I'm not personally involved with that, but I recognise, again, so I went on from biochemistry to public health and did a lot of international research. And I really understand that if we are going to have the solutions, for example, about the treatments and therapies that exist, we need to have large trial sizes and need to, and the point that you were making, Lynne, it needs to be, and I think Carolina, dementia affects everybody, all different communities across the globe. We need to make sure that any interventions are appropriate and can be replicated in those different communities. So it's really important that we do have large scale trials that engage right across the world. But it's also about, I think, providing that sort of recognition that of our common humanity. And that we can come up with global solutions that are going to affect all of us and all communities, all countries, and that we should be doing that. Participation in trials is something I know that within the UK we're trying to push, but it also needs to happen, as I say, right across the world.
I think that's right. And I think the numbers of people with living dementia are really quite significant globally. I think rising to something like 140 million people by 2050. So it seems imperative that we kind of drive that that cross-border cooperation to kind of, as you say, just, this is about humanity and improving quality of life for so many people, but we can learn so much from best practices and research findings.
Can I just say, from a political perspective, I mean, we need to give credit. I'm a Labour politician, but to David Cameron, who really, in terms of the work he did with the G7 to get this on the international stage, and we need another push in this direction. But from a political perspective, the leadership that was shown then was really important, and we need to see more of that.
I was just going to say, Debbie, you took the words out of my mouth, because I was just going to say to say to Mark that dementia-friendly communities were developed really in the UK as a result of that kind of dementia-friendly kind of approach, and they are just so important to helping communities to work together to reduce the stigma and create dementia-friendly environments that can really encourage people with dementia to be included in their communities. Can you tell us a little bit about that?
Yeah, I mean, and I think kind of zooming out a little bit, there is a lot, and I think we're sometimes a bit bashful in this country. We have pioneered a lot of stuff in this area, particularly around community engagement, particularly around how some of the political community is mobilised around dementia. And going back to your international point, we were at the G7 recently. My boss spoke to ministers from all G7 countries about the need for global collaboration, particularly with the advent of disease-modifying therapies and the hope that's on the horizon around slowing down the disease. Potentially, I'm meeting personally Alzheimer's Disease International, our colleagues from there, in a few weeks in our office, and we had a delegation from Denmark in a few weeks previously to talk about collaboration of the third sector in applying some scrutiny and pressure and thought leadership, because I think the way that charities in this country operate and how we are part of the system and quite often part of the solution to some of the big system challenges is unique. and the way that the British public contribute to that from their own pockets is unique. And I think we need to celebrate that and recognise that. And people like me have got a big role in making clear to the decision makers at the top of government and the top of the NHS and elsewhere that charities like ours are much more than just the voice of lived experience. We are system leaders in our own right. We are enormous funders of research. We're thought leaders, and yes, we provide services, and we're here to hold people to account, absolutely, but we're here to be part of the solution as well, and that plays into everything, not least the research points that others have been making. We've got a duty to make clear that relative to the scale and the challenge and the burden of disease, Alzheimer's disease and dementia research has been way behind other kind of comparable big killers. And it's great, as Debbie says, that we have had the commitment from government to double research funding, but we need to go further beyond that if we're to continue to make progress and continue to realise some of the more exciting scientific developments that we've seen recently.
And Carolina,
I think it's the responsibility of everyone to collaborate internationally. And IQVIA, from that side, we do participate in different initiatives around the world, because we feel that we have to design smart clinical trials, we have to support clinical research, but we also have to develop new sites and new regions, like Africa, for example. We have to help with the fragile infrastructures that they have and with the inadequate training of healthcare workers there, because moving forward, we will like to take clinical trials to those regions too. And I think it's something that we have to all collaborate and feel responsible that we have to call an action.
Absolutely. And of course, one of the key areas that always comes up in any conversation about the dementia is that how important it is to prevent, and how we need to invest in prevention of a lot of long-term conditions that are associated with aging, but also dementia. But how can policymakers foster this public awareness and education about dementia to really promote that kind of really understanding of the causes and ultimately prevention of dementia? Debbie?
Well, the opportunity, for example, of World Alzheimer's Days is so important, and of course we have the Dementia Action Week in May as well, and this gives a focus for us to raise these points, to raise awareness about the different conditions, but also what we can do in prevention. And I tend to say, as we know, what's good for your heart is also good for your head. So making sure that people are exercising, looking after their diet. If they have conditions like diabetes, making sure they're properly managed, and so on. If you're struggling with smoking, to try and find a way to quit. There are some fantastic smoking cessation classes around, and using that opportunity to raise the focus of these diseases. There is a lack of understanding. I think Mark's point as well about ensuring that there is a greater understanding is absolutely key.
Fantastic. Does anybody want to just say any other statements or anything, just as we're approaching, I think, the half hour?
Could I jump in, just to add to that point around awareness? And when I think about prevention, I also think about the prevention of points of crisis in people's lives after diagnosis. And we can't do that unless people actually get a diagnosis. And we had a campaign running around Dementia Action Week, both this year and last, around trying to encourage people to think about dementia and the signs and symptoms as not getting old, but getting ill. And we found that helps people in going and seeking advice, primarily, ideally, from their GP, if they're noticing that they're repeating things or having issues with their memory. it's a disease, it's getting ill, it's not an inevitable part of aging. Identifying that and enabling people to have that discussion with a professional is a really, really important next step if we're to get people the support that they need.
Yeah, and I think for that, we need to increase awareness, because sometimes people, as you said, may attribute dementia to the process of aging, or some families may consider symptoms of something that to be ashamed of, or maybe because of these modern values of self-resilience and independence, then can be barriers to go to your healthcare person to tell them what is happening to you. And I think we have to work on that, on increasing awareness, so we can early diagnose our patients.
Debbie?
No, I'd agree with all that's been said. I think I've probably covered everything there, Lynn. Thank you.
Yeah, I'll just say a few closing remarks then, and then we'll hand back to the team if there's anything else they want us to repeat or anything. So I would like to sincerely thank the panel for this excellent discussion and the really important issues that have been raised. I think how we better understand, prevent, and particularly to care for people living with dementia in our societies and our communities is, for sure, as we've discussed, one of the most critical issues of our time here in the UK and internationally. And our discussion today has shown how investing in dementia in early life in our brain health is vital to prevention, how international collaboration is just so fundamental, as people need help and support in terms of rapidly adopting what works and research findings, and how we need to continue in the UK to invest in the very smartest of innovation and Internet of Caring things for carers, really listening and understanding and responding to people's needs and priorities. And we need policy frameworks to help us to do that. It is just so crucial for carers to have timely access to affordable, quality, long-term care options. So we really hope you found today informative. If you'd like to continue and join the conversation, as I said at the start, do follow Chamber on Twitter at Chamber Voice. And you can also register for the newsletter at www.chamberuk.com/newsletter. Thank you so much to our panel members again, and thank you very much for your support for World Alzheimer's Day on the 21st of September.